If you're having ovulation problems, if you're finding it difficult to get pregnant, or you're a lady and you notice you've not been seeing your ovulation, this slimy discharge, egg white, i'm going to put um I'm going to put it on the screen. Okay, so this video is for you. So basically, I have code. So basically, I'm going to be telling you how you will know that you're having ovulation problems, because most people don't even know that they are not ovulating. And if you're not ovulating, how would you get pregnant? Because it's when you release your egg that you will actually, the sperm can actually fertilize it. So for people that want to know the signs of ovulation, locate it. I have a video on signs of your ovulation, okay, about 10 signs that will show you that you're ovulating. I have a video here, so just locate it. And so I'm going to tell you how to know you're having ovulation problems and how to treat it, okay, and including treatment option, how to treat it, because there are actually two ways to treat it: directly, if you're tackling the direct thing, and then indirectly, before we can now go to foods that will boost your ovulation. So please listen attentively. My name is Nurse Merit and I'm a nephrology nurse. Now, basically, these are the ways to know that you're having ovulation problems. Number one, irregular periods. If you don't know what irregular period is, I have a video here. Please locate it. Or you're not seeing your period at all. Like, you usually see your period, your cycle is 28 days cycle. Before you know it, from 28 is for 2 months you've not seen your period. For 1 month you've not seen your period. So it is also very important to know that the normal cycle a woman should have is 21 to 35 days. Anything more than this, you're having an irregular period, and probably you will not ovulate, and you will probably not having period, you're just having bleeding. So 21 days to 35 days is the normal days every woman's cycle. So please take note of this. If your period is less than 21 days, it is not normal. You're not seeing your period, you might just be bleeding. If your period is more than 35 cycle days, if you don't know how to calculate your cycle yet, I have a video here. Locate that video on how to know your cycle so you understand what I'm saying. So that is for number one reason, how to know that you have ovulation problems. Number two, if your ovulation test kit is negative. Now, there's a way to track your ovulation. I've already made a video on how to calculate your ovulation if you don't know how. However, you if there's a kit that you will use to check if you're ovulating, you only use it during the days that you feel, maybe 3-4 days before your ovulation starts, right? You use it 2 days before your ovulation, you think, until throughout the day. If you've noticed that it didn't turn positive, it means you're not ovulating. If your doctor checks your egg and find out that you've not, your doctor can actually do a test for you to find out if you're laying eggs or not, or how your ovarian reserve is. So he can tell you whether you're ovulating or not. Okay, so the next one is if you're having breast discharge. Okay, you're having breast discharge, nipple discharge, and you know that you're not pregnant. This is likely that you will not be ovulating. So this is why it will be very difficult for you to get pregnant, and this is usually because of high prolactin. Okay, so before I go further, I've mentioned about 4 really reasons why you may not be ovulating. Okay, and I think I have a video on causes of you not to ovulate. What will cause you not ovulating, which are infection, PCOS, and some of these things that I've mentioned here. You can locate the video. So now let's get to treatment option. Now the treatment option, there are directly, like I said, directly treatment option and indirectly treatment option. Directly treatment option is to treat the issue, okay, which is, for instance, if you're having thyroid problems. So if you're having thyroid problems directly, if the doctor treats your thyroid issues, because most women have thyroid problem but they don't know, if your doctor treats your thyroid problem, your ovulation will just come back normally. Number two, high prolactin. If you are seeing this breast discharge on your breast, it usually, most of the times, your doctor will ask you to go and do a hormonal profile test, because usually it's as a result of high prolactin. Okay, so what your doctor does is, if your hormonal level is imbalanced, depending also on the kind of hormones that is imbalance. So usually if the prolactin level is high, it is only high when you've given birth and you're breastfeeding. Okay, however, after you stop breastfeeding, it goes normal. But if you're still seeing discharge even when you're not pregnant, or it's been long you've gave birth, it simply means that something is wrong and probably your hormones are high. All you need to do is your doctor will prescribe usually a drug called cabergoline. Okay, this drug will restore your hormone, even bring back your ovulation, and you take in immediately. Please, I am not saying that you should go get this drug. I am telling you, how the treatment, the course is. Any drug you're going to take, make sure that you consult with your doctor first, because some of these drugs has side effects. Some people, there are some certain conditions that may not be used, this drug cannot be used on. So please, but however, these are the drugs that your doctor may prescribe to you. It will return your hormones level, and immediately your ovulation is back, you and the breast discharge will stop. Now the next one is insulin resistance. This is another reason why women, you know, don't ovulate. And also, I'm telling you how to treat this insulin resistance. This is seen in women that have polycystic ovarian syndrome, or PCOS. So if you have PCOS, where the ovary has a lot of cysts, a fluid filled sac, you will find it difficult to ovulate, because most of the times the egg will not be matured enough to break, okay, or for you to lay it. So ovulation will be hard, and therefore achieving pregnancy will be hard. And insulin, your body will become resistant to insulin. And how to deal with this is simply by trying to lose body weight. If you are overweight, trying to reduce saturated fat, sugar, complex sugar, carbohydrates, all these things, all this bread, all these teas, all this added sugar. Try to lose them. Try to work out, moderate exercises, lose weight, drink water, fruits and vegetables. Okay, reduce fruits that has a lot of sugar in them. Okay, you can make your sugar come up a little bit. Okay, try okra soups, vegetable, cucumber, ginger, garlic. I'm going to make a video on boosting your ovulation with this food, on foods that helps you boost your ovulation. That will be on the next video. So in this PCOS, once you reduce what you eat, it will help you a lot. It will bring you, in fact, if you lose 10%, if you're overweight, 10% of your weight, it will bring back your ovulation. Now locate that video on the interview I had with a gynecologist on how to conceive with PCOS. Everything you need to know about PCOS, for every question you have, is in that video. However, you have to listen attentively, because it's a live section with a doctor, so it's not really very audible. Okay, now other drugs can also be used if you have PCOS to bring back your ovulation, or to reduce insulin issue. Example, this drug is metformin. Okay, people that have PCOS, that have insulin resistance, metformin is usually prescribed for them. This helps them regulate their period, regulate their insulin, and they get back on track. Okay, now what happens if, like I said, indirect treatment? What happens if your doctor doesn't find out that there is no cause for you not ovulating? You don't have PCOS, you don't have anything, you don't have anything, but you are not ovulating. Now there are some other drugs that can help you ovulate. So these drugs, other group types of medication that will help you ovulate, these drugs are called fertility medication. Please be careful, and a disclaimer, like I've been saying, each drug has to be prescribed by your doctor, by your gynecologist. I'm just trying to let you know that if you're not ovulating, there are things that can be done for you to ovulate and carry your own baby. The only thing is that you need to, you know, find out that everything is okay with you. You're not having fertility issue, you know, blocked tube, no semen issue. It's just that you're not ovulating. Hey, so now these drugs, for instance, it can come in pills and in injection. So the pills, example of the pills are letrozole. You may have heard this. These letrozole work for women that has PCOS. Okay, there are some other drug, for instance, clomiphene citrate. This pill also work for other women, if you don't have issues, so this will help some other women ovulate. Now there are some injectables too that can help women, but remember, these are fertility medications. Okay, it is very important to know that this medication, fertility medication, can increase your chances of having multiple pregnancy. It can be 3, it can be 4, it can be 5, it can be 6, it can be 7, and this increases complication. Multiple pregnancy has complications. So if you're taking this drug, make sure you're being monitored and it's being prescribed. Okay, and know that there are complications, which is this multiple births. Okay, so on my next video, I'll be telling about food and natural food that will help you in that boost your ovulation and how to get wet finally. So let me know what you think about this video. Make sure you comment on the comment section, like it, so that YouTube can suggest it to some other people that are having fertility issues. Okay, so if you're having low sperm count, your husband is having sperm issue, watery sperm, you stand up, sperm comes down, locate all the videos here on my YouTube page. Remember, my name is Nurse Merit and I'm a nephrology nurse.